I have a question. Is health equity still a thing, even though DEI has been dismantled within most organizations? I don't care if DEI has been dismantled in departments and in healthcare centers and workplace environments. To me, health equity is still a thing, and I'm not afraid to talk about it. And especially when it comes to reproductive rights and healthcare needs of Black women and minority BIPOC communities, because it's still an issue. And women and people are still dying because they don't have healthcare easily accessible to them, and they live in rural areas, or sometimes they don't live in rural areas, and just because of generational trauma, they don't feel comfortable coming into the health centers. So I'm still advocating, and I'm going to always continue to advocate. I've never been a person who bucks down from a challenge or am easily bullied into not standing up for the things that I believe in. But this week I was really heavy, for a lot of reasons. But one of the main things was that I was told that, you know, I needed to be careful when I'm talking about such things. So basically, tote the line of being more discreet and not being so, to me, radical is what it boils down to. And then followed up with, but continue to advocate for your patients the way that you do. And I'm like, is that an oxymoron? I mean, is that even a thing? Like, I mean, if I believe heavily that minorities oftentimes lack the health care that they need when it comes to pain, language barriers, uh, just education level, not understanding, the directions to follow. And as me for a Black woman, it goes back to, you know, the inhumane things that were done to us in healthcare as far as experimentations and, slavery, being forced, raped and being forced to bear children that we had no choice over. So it is personal for me, and I don't know how I can be any other way. I mean, how can I be authentically myself, and not be radical when it comes to reproductive health? I don't think that the two can coexist, especially in today's climate. You have to be radical, and in most places that I frequent, as far as social media, people aren't backing down from diversity and inclusion and equity. I mean, just because, somebody is saying from the top that we're no longer honoring these systems, we as healthcare workers know better, or should know better. People are going to die. And the people that are going to be largely affected is going to be my community if you take away reproductive rights. And we don't speak on it. So it is just that important. And I don't know. I'm trying to figure out what a disconnect is, really. I'm at a loss. So that's why I am talking to you all about it, because I want to get your take on it. I want to know, um, is this a thing? I mean, are you all feeling pressured in your environment? I just don't think that I can do that. I don't think that I can't work and be concerned about who I'm offending, or who might take what, take it out of context, or think that I am showing favoritism to one race over another race. All minorities are at risk, and I'm going to advocate for all patients, first of all, but especially the BIPOC community and the Black community, because they are the ones who are at most risk. And most places that I have worked at in the last 5 years or so, um, have been very receptive to learning the culture differences, and especially white women, that are in healthcare fields. They welcome this information because they're not taught this information in medical school. And so when I, bring the topics up and talk about, the disparities that have happened in the Black community, they are very grateful for this information. And at least that's the way it's been expressed to me. I've never, been told that this is offensive or can make people feel offensive. But then again, Donald Trump wasn't the president at that time either. So I'm just, wondering, like, is this really a thing? Or what you all are experiencing, those of you that are in healthcare field or work, for the federal government or places where you're being told. Because I mean, even for me, it was like really different this year to not have anybody say Happy Juneteenth, you know, or it be publicly, said that it's this is Juneteenth month, or to, say Happy Pride. So I'm just, and so this week when this was brought to my attention that Keisha, be careful, that you don't tote that line and then get in trouble, for it appearing as though you're discriminating against other patients and prioritizing minorities, which I still don't understand that anyway, because our whole community is 90 something percent minority. So who exactly am I offending? Um, when our whole community is minorities, most of them. Um, but anyway, it didn't occur to me until after that conversation. Oh, that's why this year, there was no Happy Pride Month or Happy Juneteenth or anything like that, because of the whole DEI thing. And I'm just, I don't know why. It's been 2 days now, and I'm still heavy with it. Um, I think more than anything, I'm heavy with it because you know that I would even be involved with an organization that doesn't deem those things important, and I think that's what it's weighing heavy on me. And I just walked away from that meeting like this is not going to be the place for me, because I'm very outspoken about what I believe in. And, I didn't become a nurse to not advocate for patients. And if I feel as though my patient is being not listened to or not heard because of a language barrier, or if I feel that my patient is not being recognized or receiving the care that they need because of the color of their skin, I'm going to say something. That's just what it is, and I can't help the fact that I'm also a Black woman. So I am going to take those things very personal because that is my lived experience. That's what I've walked in, and so I don't know any other way. What did I become a nurse for if I can't advocate and stand up for my patients? So whether it's abortion, whether it's this patient is having a miscarriage, whatever it is, this patient wants an IUD, and but is scared because of the things that they've heard from grandma or auntie about, what they did to Black people, years ago, not even that long ago, really. It's probably like in the 70s or 80s. Actually, no, I'm sorry, it was the 90s, where they were encouraging or encouraging Black women or women that were on welfare. So again, women of color primarily is who they were targeting us towards, because we were no longer a need for them. So we went from them needing us because they wanted us to mass produce babies so they could go work out in the fields, to now we're no longer in slavery, so we have no need for these little brown babies. So we want you all to get on birth control so that we can control how many babies you're putting out, even to the extent where they were willing to pay women that were on welfare to get the Norplant, into their, or I'm sorry, not Norplant, Nexplanon. So sometimes we have people that come in and they're just like, I really am not very comfortable with the birth control methods because of X, Y, and Z, because this is what I've heard, you know, or just like educating, women of color or just minorities in general on HPV, because what community of people are dying from this? So I just, it's that serious. And to me, it is. So I don't know. I don't know if I'm making too much out of this and I'm just overly sensitive about it. Or if you all are experiencing this in your workplace as well. So I would love to hear from you. To just tell me like, Keisha, you're tripping, or unfortunately, yeah, this is a thing. Um, but regardless, I don't know, y'all might see me in jail or without a job, jobless, because I don't see my stance changing on this at all. I couldn't look myself in the mirror at the end of the day and say that I did no harm to my patient if I continue to just worry about what's politically correct in terms of what is coming out of my mouth in terms of education. So anyway, thanks. I always like to leave my videos with gratitude. So even though, like I said, it's been a really rough week for me, um, and Mercury, I believe, is in retrograde again. I am eternally grateful that I made it through this week in one piece. I'm so grateful that it's Friday. I'm grateful that I have this space that I can come to and just meditate and inhale and exhale. And I got my incense going, which brings me peace and solitude. I have my plants. I'm really grateful for that. I'm grateful that all of my children are in one piece and that I have my two dogs here, which, most of you should know Ivy by now, but look at her hair. She is a wild woman. I try to put it in a ponytail and I want her to be dainty, and she's just not dainty. She is literally a wild woman. She's my problem child. If when I do have a ponytail, it has the gangster leaning to the side because she's just wild and crazy. And then my little blue, who's my little angel, who is just laying here trying to cozy up with me and is just happy to be with me no matter where I go, is laying here on my lap. So these are my two emotional support dogs, and some of you already know, but I got Blue in 2021 after the death of my brother, and he has really helped me tremendously with my grief. And he also was with me when my mom got sick this time last summer. Blue was on the road with me. We were on that plane back and forth, and he was right there with me by my side. And I don't think I could have done it without him. And then Ivy was one of my mom's dying wishes before she died, and she always wanted to breed puppies, and she didn't get the opportunity to do it. She thought she was going to do it when she retired, and she got sick, and she passed away in September, so not quite a year yet. But my sister and I got her these two little Yorkies, so my mom got to enjoy them for her last weeks here on this side of the spectrum. Um, and she's since gone on to be with the Lord in a better place, no longer suffering. But my sister and I adopted. So my sister has Ivy's sister Chloe, and then I have Ivy. So yeah, she is a handful. And Blue and I are used to just chilling. And if I'm not getting up, Blue's not getting up in the morning. He's just like, I'm good. I don't need to go anywhere. Ivy, on the other hand, as soon as the sun comes up, she's like, all right, let's get up, let's go. What we're gonna do? Yeah, she's a lot, but I'm very thankful to have this piece of my mom still. So anyway, I hope you guys have a great weekend, and I do hope that you do interact with this video, and I'll see you next time. Peace.